Sam Altman, CEO of OpenAI, has said that India's AI opportunity is amazing, calling the country one of the company's fastest growing markets globally, possibly the fastest. Altman also revealed that more than 100 million people in India use ChatGPT every week. Let's in fact listen into that statement.
India's AI opportunity is amazing. It's great to be here. This is one of our fastest growing markets in the world. Maybe it's the fastest at this point. It's certainly the fastest for Codex. There's more than 100 million people that use ChatGPT every week. We're delighted to be here.
Thank you, Sam.
All right. In fact, we heard the CEO of OpenAI over here saying that India is one of the fastest growing markets globally, even in this sector. Dr. Mitra, if I can come to you regarding this, when you look at AI, when you look at this sector, what are the opportunities that you see? You also, throughout the day, we've been hearing these tech, big wigs give out speeches, talk about investment, talk about data processing, talk about how, the global South can provide a lot of data. We just saw the CEO, we heard his statement. He is also speaking about how India is one of the potentially the fastest growing market globally for this sector. So, when we look at this AI generation, when we look at the Prime Minister's vision of Manav, how are you observing this sector grow? Dr. Mitra.
Yeah, good afternoon, everyone. Thank you so much for having me here. I think this is a topic which is very, very relevant. The impact of AI in healthcare and where do we go from here way forward. I had a talk day before yesterday at the AI Summit also on the same topic. So I am an oncologist. So among all aspects, all fields of specialties of medical care and healthcare, oncology is probably a very, very important domain where AI has its effect. If I can say that, being in oncology, we have been using, may not be in the same name, but we have been using something like AI, that is artificial intelligence, since long. Now, where do we see the impact? Like all of us, we know that cancer, the detection of cancer is time dependent. The earlier you get diagnosed, the earlier you get treated, and the chances of getting cured is much higher because the patient is diagnosed at a very early stage. So what does the AI do? The most important is that the AI helps in a very quick diagnosis with accuracy. So if it gets diagnosed faster, of course, we can get treated earlier. And why is it getting diagnosed early? Because the AI is trained with lots of data that what are the areas it sees, and then diagnoses a particular cancer at the right stage and with equal accuracy. The second is that, which is now we are dealing with, is the personalization of the treatment. If we see breast cancer patients or 5 patients, they may be of the same stage. Second stage breast cancer patients, for example, we are seeing they may be of the same stage, but they will not be treated similarly. So every patient will be customized. A treatment will be tailor-made for them. So how did we do this? All of this is partly and largely because of the AI which we have introduced in our treatment system. So other than this, we have the, if we talk of work efficiency, because it is faster. So we doctors and other healthcare workers, we take help of the accuracy and the quickness of the AI so that we can devote our time to more other things. So that helps increasing the work efficiency. Now, if we look about on the hospital front, everything is quickened, like the work efficiency of the hospital staff, like getting a bed, getting an appointment, after the patient is admitted, getting the investigations and the reports early. All these are greatly impacted with artificial intelligence. One more thing which is important is the area of early detection, and that is the preventive, that is the cancer prevention. So we have several AI models where the cancer can be detected early. And one more thing which I would be saying here is that what our PM was
Right,
talking of about democratization.
right.
We have all the facilities uh, in the urban areas, but most of our patients are in the areas which are less served.
Right,
So
and
how do
I
we
think